mentioned, Jess, we are really excited to have Dr. Keckler back with us today for another Facebook Live event. We're going to be discussing ulcers, and he has a lot of information to share with you guys. We know this is a big topic with a lot of our customers. It's probably one of our biggest categories of supplements that we carry and that we sell.
Yep.
So it'll be really nice to have a vet's perspective on ulcers. And at the end, Tish is going to clue you in on some great giveaways and deals we have going for you.
And some of the pictures, I mean, we were looking at them earlier. They're amazing. So tune in and take it away.
And make sure you ask questions too.
Yes, please. All right. Oh, lights. Got it. All right, all you.
Beautiful. So hi, I'm Dr. Ken Keckler from Buckeye Veterinary Service in Burton, Ohio, and we're going to talk about equine gastric ulcer syndrome that has been abbreviated as EGUS. I don't really use that terminology, but that's what's out there. It is an incredibly common problem. They think that 90% of racehorses have stomach ulcers. Probably 60% of non-race performance horses have stomach ulcers. And one of the difficulties is that the clinical signs for the stomach ulcers are very nonspecific, as you'll see. It's potentially caused by the lifestyle, stress, and non-steroidal anti-inflammatory drugs, and we'll talk about that. So this is one of the types of horses that I see on a routine basis, a nice hunter, very pretty horse, looks nice and healthy. Looks don't necessarily mean that we do not have stomach ulcers. So the symptoms are non-specific. So what are we talking about? Colic, especially shortly after they have eaten. The acid production goes up after they've eaten, and the acid can potentially make them more uncomfortable. So a change in attitude or behavior. If they are girthy, reactive to touch around the abdomen or flanks, that could potentially be a sign. Their performance may decrease, the quality of their performance. Their appetite may decrease. And you could have weight loss. And something that's going to be hard to define is a heartburn sort of a situation, but some of these horses could actually be uncomfortable because they're feeling a heartburn like we would feel as the acid creeps up into a portion of their stomach. So here's a horse with colicky episode, kicking in his belly. That can be a sign of stomach ulcers as well as other types of colic. So let's talk about the causes here quickly. Part of the problem is the way that horses are designed and the way that we take care of them. They have a very small stomach for their relative size, so they are supposed to be constantly grazing, and so they're constantly making acid to digest the food that they're eating. So most of the time, we've confined them to a stall and we feed them 2 meals a day, which is not what they're designed to do. They're also herd animals, so they're supposed to have friends and neighbors that they can communicate with. We keep them as individuals in a lot of cases, and that is stressful. And exercise will cause the acid production to increase. And these horses are stressed because they're training and they're shipping. Training, again, when they're exercising, the acid goes up. And shipping is one of the most stressful things we can do for these horses. If we want to make a horse sick, the best way to do that is to ship them, trailer them for a distance. The high carbohydrate meals that they get, the grains, are potentially going to cause more acid production. And non-steroidal anti-inflammatories. One of the misconceptions is that if you give it to them IV, it's not as bad as giving it to them orally. That's not true. So if you're giving it to them intravenously injected, or if you're feeding them orally, it's the same sort of a thing. And those are butanamine, ketoprofen, naproxen, and Arquil are your typical non-steroidals that we're using on a regular basis. So there's also talk that there might be a bacterial component to stomach ulcers in horses. In people and pigs, there's H. pylori that causes stomach ulcers. We're not sure about that in horses. They've not been able to find bacteria in stomach ulcers in horses when they do biopsies of those. So we'll talk about the normal stomach quickly here. Normal stomach has a couple of different portions. The upper part of the stomach is made up of squamous cells. It's non-glandular, and those cells are an extension of the esophagus. So the same cells that line the esophagus come right down into the top part of the stomach. That portion of the stomach is very sensitive to acid. The glandular portion below that makes the stomach acid and is not as sensitive. And the dividing line between those two sections is called the margo plicatus, commonly called the margo. When you come down and go to enter into the pylorus, which is the part of the stomach that opens up into the small intestine. That section is called the antrum, and the pylorus is the entrance to the small intestine. So we'll look at this here. So what you can see in this is the greater curvature of the stomach here. This is a cross section of the stomach. This is the lesser curvature. This is the esophagus opening here. And so this is going to be the antrum. So what happens when we go in with the scope, we actually have to loop around and see this portion of the stomach, and then we get under the antrum and into the pylorus and potentially into the small intestine. This is the margo plicatus, this line that divides the glandular portion from the non-glandular portion. So that's what we're talking about with gastroscopy. We have a 3-meter scope. Sorry, that's pixelated, but we have a 3-meter scope. And this is an image of Dr. Shaw and our technician Gail, and they are gastroscoping the horse. So we have a laptop that the scope plugs into. The scope is passed up the nose. They swallow it into the stomach, and then we have, this is a pump, and we actually pump air into the stomach to expand it, because if you can imagine the stomach is empty, it will contract, so you won't be able to see things very well. So we pump air into the stomach. Potentially could also suck fluid back out if we want to. A lot of times we're spraying water through the scope to spray off the wall so that we can see things that might be covered up. And then we suck the air back out when we leave. If you leave the air in, they can become uncomfortable with that. So here is an image of a normal stomach. So that's the stomach fluid on the bottom. And then again, this is the margo plicatus here. I think that's the next thing that comes up. And it divides between the squamous portion, the non-glandular portion, and the glandular portion. Again, the glandular portion makes the acid that's in the stomach fluid, and the non-glandular portion is more like the esophagus. So here is an image of a normal stomach again, and this is the antrum. So the opening from the esophagus would be above that, and that's where the scope would come in. And typically then we're going to loop around the stomach and then go into the antrum to get to the pylorus. So this is a picture of a normal small intestine. So the pylorus looks kind of similar to this type of tissue. It's a sphincter opening. We'll see that in a few pictures. But this is all lined with tiny little villi that are going to be used to absorb and do the fluid absorption and things in here. So it's kind of like a little shag carpet. These are the bile duct papillae. If you get back into the small intestine, you can see those, and a lot of times you'll see the yellow bile that's being produced by coming through the bile duct. So this, again, is going to be a little pixelated for you. But this is kind of an abnormal stomach. This is maybe the first kind of thing that the horse might find is this is kind of a heartburn situation. So normally you would have white-looking material here, and all of this is kind of like a sunburn with the peeling skin coming off of it. So the tissue underneath it is pink and irritated, and this is the superficial layer that's been irritated by the acid coming up. So what we do to scope these guys is, usually we're trying to scope them first. What we're doing with these guys, if you missed it, because we had a little malfunction here, we usually fast them from about 5 o'clock the night before, and sometimes people will stop their water 2 to 4 hours before we scope them, but at least stop the food about 5 o'clock the night before, and then do the gastroscope at about 8:30 in the morning, so that you don't have a mat of hay in the stomach. If you go in with the scope and you run into the hay, you won't be able to see much of anything, and you will not be able to get into the pylorus to see that part of the stomach. So what we're going to look at now is some abnormal pictures. This is kind of a grade 1 ulcer. So again, you should have nice pink, you shouldn't have pink squamous tissue. It should be nice and white, and it should look thick and dense. And you can see the little wrinkles in the side. That's one of the reasons we fill them up with air. The other thing to keep in mind is those wrinkles, when the stomach is not expanded, those wrinkles are a great place for acid to kind of creep up into and lay there and burn. So what we're looking at here is an early sort of an ulcer, this pink discoloration of what should be normal white dense tissue. And here's some more grade 1 ulcers, and these are more focal spots that are in the squamous portion of the stomach. that have been eaten away through by some stomach
So
acid.
each one of those would be the beginning of an ulcer, those
Each
little
one of
bits.
those are ulcers, but yes, absolutely.
We have a question. What signs and symptoms would you see in a horse that would lead you to want to pass a scope?
Any of those things that we talked about, again, chronic intermittent colic, especially after they eat. One of the things I didn't mention that's talked about a lot of times in babies, but teeth grinding can be a sign of stomach ulcers, poor performance, weight loss, bad hair coat. I think the biggest thing that I see that makes me want to scope these horses is a behavior change. To me, that's the biggest indicator right now. A lot of these horses, they were nice, well-behaved, nice to be around horses, and all of a sudden they're unhappy, they're crabby, they don't want to do their job, they don't want to go forward, they're trying
girthy.
to nip at their owner, they're potentially girthy. And those horses that have attitude changes, if there's no good reason otherwise, this is a very good reason.
It's a good place to start.
Yeah.
So, grade 2 ulcers are going to be more severe. So this is again, it's a little pixelated, but this is the scope coming in. So we are with the other end of the scope looking back at the scope. This is the entrance into the stomach, and what you can see here is this whole area underneath here is just burned. It's ulcerated. The stomach acid has eaten away at this thing. And so, yeah, there you go. So grade 3 ulcers are going to be even more significant. They're going to be all down into the normal pink underlying tissue of the stomach. So there's going to be several pictures of this, but you can see this is the margo plicatus down here. That should all be white, filling in all the way through all of this. So it should be this, and you can actually see how dense and thick this tissue should be where the craters are. So the hay is kind of stuck to the edges of this thing where the ulcers are, and we're going to see some more of that. But all of this is ulcerated all the way up into here. All of that is abnormal and is obviously going to be painful and be a problem.
I have a question in regards to that personally.
Yes.
So where you see that separation where the ulcer is, with proper treatment, does that lining grow
Yes.
back? So
It-
you
it
can
will.
actually treat
You can
and heal
make them
ulcers.
better. You can make them 100% better.
Really, 100% better.
Yeah, yeah.
Okay.
You're going to have to follow up with that.
I
Right.
think you have to
You
stick
have to-
with what you're doing
Exactly.
in order.
Gotcha.
And we'll cover some of that too. But again, same sort of a thing. Really deep crevices where that tissue has been eaten away. Again, the hay just sticking in there. And this one, you're kind of looking through a valley. This should all be this dense, this thick. And it should all be filled in all the way through all of that. And it is obviously not. It's all eaten away and ulcerated. It's very, very unattractive. And this one, you can actually see that this is down into blood. So there's actually blood
that's
seeping into that.
So this part over here is
Yep. So all of this
bleeding
again is all of this is normal thickness, but it's been eaten away, and you have little islands of tissue that should be there, but all of this has been eaten away all the way through all of that.
Okay.
So yeah.
I think you touched on this before, but I think maybe when our video cut out, we have a question. In your opinion, are there external factors that contribute to the formation of ulcers, for example, high grain and low forage diets?
Absolutely. We'll talk about potentially changing your husbandry with increasing the hay and using alfalfa hay. But yeah, high carbohydrate diets potentially increase the stomach acid, stress, shipping, not being around other horses, potentially stressful. Anything that's potentially stressful, as well as the biggest thing is non-steroidal anti-inflammatories like butanbanamine will cause. Again, whether that's IV or oral, it still causes the problem. So bots, there's been a discussion that maybe these are bots attached to the stomach that we saw in scope, and there's, these are the ones that start as flies. They lay the little yellow eggs on their front legs, and then they migrate and end up in the stomach where they attach on. So there's been some discussion because sometimes we see ulcers kind of in that area, and most of the time when we see bots, they're in that spot. So there's a discussion as to whether those could have some bearing on stomach ulcers or not.
Or do they look for spots where there's already an ulcer to
that's a
make
good
it
question,
easier
too.
for them to find a home?
But this
A
is
little
easily
crevice.
Yeah.
easily treated with ivermectin or moxidectin, which is Quest. So they're easily taken care of, but we see those fairly often. So this is a pyloric lesion, and what you want to see with the pylorus, again, it's a sphincter muscle, so it's going to be a round muscle. This is kind of open in an odd little distended way, but you can see this is bleeding. These are bleeding areas on the mucosa of the pylorus here. So this would be going into the small intestine right here, and this is some stomach fluid. So basically you have to go under the antrum and work your way back up to get into the pylorus. So what we looked at in this picture is fairly accurate. When you come in with the scope, we loop around, but you have to go under this and back up into, this is the pylorus, so it's going to be a round sphincter muscle, and then we get into the small intestine. So it takes a little bit of work sometimes in some horses to get there. Some horses it's easier than others. But so there's pyloric lesions, and then this one again, this is a fold of the actual sphincter muscle itself, but you can see how bright pink it is. That is very aggravated, and this picture is one of my all-time ugliest things that I saw at the pylorus. Again, it's pixelated, but here's your opening. Yeah, it kind of looks like a crater that you could go into, and that's what you want to try to do with the scope, is work your way around to it and go in. But this is almost like a pustule. There's a big mound here with pus sitting on the top of it, and obviously it's bleeding. There's blood all over down here from this thing that's been seeping blood and probably some pus into the stomach area. So treatment, the only thing that has been proven to be effective against these things on a consistent basis is omeprazole, and the only one that is out there that has been proven to be consistently working is GastroGuard or ULCERGuard. Omeprazole is a proton pump inhibitor, so it stops the pumps that make the stomach acid, which then decreases the amount of acid that is produced. There's been multiple studies on compounded products, and until somebody comes up with one that works, as far as I know, there aren't any that work like GastroGuard does. Even if they say they're omeprazole, they're either denatured or they don't get to the small intestine to be activated. So
now, GastroGuard is the vet prescribed, and then ULCERGuard is over the counter.
that is correct, but they're exactly the same.
Exactly the same.
So whatever is in the tube of GastroGuard is exactly the same as what's in the tube of ULCERGuard. They might be divided differently, and the writing on the tube is different, but if you take that tube, it's the exact same product in the exact same tube. It's just confusing.
It is confusing, but if you listen to your vet and just go from there, then they'll be able to tell you exactly what to feed or what to administer.
You can use either one of those products, replaceably.
Yes, exactly.
So it's a patented formula. The big deal is that the drug has to go to the small intestine before it will work without being degraded in the stomach. And again, the other products have not been proven to do that yet. So it attaches to these pumps and it keeps them from working, and it doesn't just work while the drug is in the stomach. It lasts much longer than that. Unlike some other products that, like for instance, like cimetidine, ranitidine, which aren't the same type of drug, but those drugs have to be used over and over again to keep their effect. So typically you're looking at a 28-day treatment protocol. It depends. You may need a longer time or a larger dose, and that's one of the reasons why it's good to scope these guys. If you see that heartburn look, maybe you don't need to go as long. If you see aggressive lesions in the pylorus, we're going to treat those differently than we're going to treat the treatments that are in the upper part of the main part of the stomach. So, and we'll cover that too. So that's GastroGuard, oral paste for treatment of stomach ulcers. Some of the additional things that have been used and are still used, Tagamet, cimetidine is a human drug. All of these are human drugs here. Ranitidine is Tack. It's a human drug. They are H2 blockers, so they inhibit gastric acid secretion. They have to be used more often. Ranitidine is favored over cimetidine right now, but it needs to be given every 8 hours. So it doesn't work like GastroGuard does. It's a different mechanism, but GastroGuard binds and stays where the other drugs you have to give them repeatedly.
We have one question. What are the risks with stopping stomach acid completely?
Well, they haven't been able to stop stomach acid completely, and that's a fair question as to whether it changes their digestive pattern. From what I've seen, we don't really see any specific problems with that. Now, we've been doing this long enough. If we're going to have problems, we might very well. But in most cases, you're going to, hopefully, what we're going to do is treat them with the GastroGuard until they're healed, and then change the way that they're fed and the way they're treated, and then treat them with GastroGuard when they ship and show or race.
Right before the performance?
Before they perform. So what you would typically do once they're treated and healed is it's suggested to start like 48, 36, probably 48 hours to 72 hours before they leave, to start them on at least a half a dose of the GastroGuard, a half a tube of the GastroGuard. It's also labeled as a quarter tube, but I usually use a half a tube. And then start them on that. I usually start 2 days before they're going to ship, and then leave them on it until they get back home again. So those horses don't reactivate the stomach ulcers. One of the other drugs that we use fairly often is called sucralfate. It sticks. It's been described as like a bubble gum that sticks to the surface of the ulcers and in the glandular portion of the stomach, which again is the lower portion of the stomach, and so it kind of helps protect them from the stomach acid. And it also is potentially a buffer. So there's ranitidine tablets, sucralfate tablets. Again, the ranitidine decreases the amount of acid, and the sucralfate kind of binds to the stomach ulcers. And one of the reasons that we like the sucralfate is because when it binds to the stomach ulcers, it may also bind to the antibiotics and stick the antibiotics that we're giving them onto the stomach ulcer. So most of the time, if we're just dealing with the stomach ulcer in the main part of the stomach, the upper part of the stomach, in that squamous tissue, the non-glandular portion, we're just going to use omeprazole. And most of those horses do very well. But the ones that are in the glandular portion, especially down by the pylorus where it goes into the small intestine, those horses frequently need antibiotics. So you would give them GastroGuard, sucralfate, and antibiotics. So you're going to give them orally, and it may stick in the sucralfate that, as it sticks to the ulcer, may help heal that. And the two drugs that we use most of the time are SMZs, sulfa drugs, or doxycycline or minocycline, which are tetracycline derivatives. And minocycline is much less expensive than doxycycline right now, so we're usually using the doxycycline. So for a lesion like this one that we were looking at before, this lovely bleeding pustule, that horse for me was put on, we actually increased the dose of GastroGuard significantly for 28 days and put it on sucralfate and minocycline. And this also was a horse that had the burn coming down below the esophagus where the scope was. Mm-hmm. This horse was crystal clear in 28 days. I was shocked. I didn't think it would be that good. Wow. But it did really well.
What kind of performance horse was this? Was it just...
That horse is probably, it's a pony. It takes grandkids around for a ride. So
oh, wow,
it doesn't have to be high-level stress. Yeah. Wow. So one of the other things are the antacids or buffers. So the buffer will, when you add it to an acid, it will neutralize small amounts of the acid, so you will keep it from being too acidic in the stomach. So the human drugs are Tums and Maalox that you're accustomed to seeing. You can get them over the counter. They're made out of calcium carbonate. Maalox is aluminum hydroxide and magnesium hydroxide, and again, they're buffers. So they just neutralize some of the acid. Sucralfate also does some of that. So the horse products then are, just a few of them, are Nalox, which is an aluminum product that we have sitting on the table here. And Nalox is, like I said, one of the ones that I saw first that was out there, and it sounds like Maalox, so that's entertaining. And UGuard is another product. It's a calcium carbonate, magnesium hydroxide product. Smart Gut has a product that's calcium carbonate and magnesium carbonate. But those products only last for a couple of hours. So the issue is that they're only good as long as they're in the stomach. So when they're fed with a grain meal, which is what they're intended to do, hopefully they decrease the amount of acid that's in the stomach while it's in the stomach. But as soon as it moves into the small intestine, it's not functional anymore. So the problem is that the horse has a small stomach and is supposed to eat all day long, and similar to us, when the food gets into the small intestine, that's when the acid starts again in the stomach, because it's assuming that it's going to continue to have food. So when the food gets in the small intestine, the acid levels rise in the stomach. What we do is we feed them twice a day. Once the food is into the small intestine, the stomach sits there with acid in it, and it starts eating away. So these products will help, but what we really want to try to do is to feed them something all day long, like alfalfa hay that has calcium in it that acts as a buffer, that they can have as much as possible in something that slows them down, like a nibble net. So Tums, again, sucralfate. I don't use Tums in horses, but I'm just putting it up there because it's something that we can all relate to. There's your UGuard pellets, your Nalox, and Smart Gut Ultra. And there's good old alfalfa. So alfalfa is highly recommended for this. Even if they're getting grass hay, the suggestion is to feed them the hay before they get the grain, let the hay buffer the stomach acid and dilute the stomach acid, and then feed the grain to them, and then hopefully we don't have as much acid production. So some other quick options. Soothing Pink is a progressive product. It's alfalfa meal. They have a study that said it showed some benefit. I don't know the specific reason. There was recently a couple of positive drug tests off of Soothing Pink in some show horses for ractopamine. They have found that it was in the Soothing Pink, and Cargill says they've taken care of it. It's not in the product anymore. But Soothing Pink, at least Progressive has a study that says that it's been beneficial for stomach ulcers. Succeed, which we also have here on the table, is called a digestive conditioning program. There's been at least one study that I've seen that says that it showed benefit once horses have recovered from stomach ulcers, as far as not getting them again as quickly or as much. Again, I don't know the specific reason on Succeed. I think some people have a lot of success with it, but I haven't seen a good, this is the product and this is why it works. In my mind, there needs to be more testing on it, but some people love it and use a lot of it, and there at least has been one study that says that it does some good that I know of. There may be more. A lot of people want to put horses on probiotics, which are the bacteria that help the horses to digest. But probiotics are used in the cecum, in the hind gut, in the back part of the intestine where the fermentation takes place, and that's not where the stomach ulcers are. I don't think there's a problem with probiotics, but they're not necessarily treating stomach ulcers. I use them a lot on horses, but it's not specific for stomach ulcers. Pepto-Bismol, I used to use Pepto-Bismol specifically for diarrhea cases. You really have to put large volumes into their stomach on a very frequent basis, and so that's not been proven effective for stomach ulcers in horses either. It'd be difficult to get enough into them to make it worthwhile. So, and then there's a lot of other things out there, and I won't be able to mention them all, but aloe vera, slippery elm, marshmallow, there's a bunch of other things out there that are potentially sold and marketed for stomach ulcers that, again, it'd be nice to see studies on some of these things and see if they actually do give you some benefit. So there's your Soothing Pink. Again, Cargill says it's clean. There shouldn't be any drug testing positives in it. The stuff that was in it was used to improve muscle growth in cattle. So, obviously they don't want it in performance horses to change their ability, but it shouldn't have hurt any of the horses that were getting it, but it did come up as a positive test. So that should be done. It should be over with, and it should still be out there being able to be used. And of course there's Succeed, which again we have here on the table. And then real quickly, some other things. There are some other side treatments that are used for more specific things. So misoprostol is usually used for glandular lesions that are backed by the opening to the small intestine. It might be useful. Bethanechol and metoclopramide are drugs that are used more to help them move stuff out of their stomach. Every once in a while we'll have horses that have delayed gastric emptying problems, that everything is slow and everything just sits in there. And we've had a couple that we've scoped that have had hay in their stomach even though they were fasted overnight, and we had at least one that came back the next day and still had hay in the stomach. So some of these horses have other medical issues that might be neurologic, if the nerves aren't functioning properly to move stuff through their stomach. And then one of the things that's discussed sometimes is things that would alter the mood, because these are stress-related problems. So Zilkine is a newer product. I have not personally used it, but I've heard really good things about it.
And we've been selling quite a bit about it.
Have you?
Yeah.
Good.
Not sure if it's for that, but.
Well, just to calm them to show and things like that. So some of the things that you can do are diet changes. And one of the issues is, do horses have inflammatory bowel problems or a celiac sort of a thing where they don't tolerate specific feeds? And I think that's out there. I don't know that we have any good testing protocols for that right now, but I think it certainly is possible that horses just have a reaction to a specific thing and they get uncomfortable and have some problems. Would it cause stomach ulcers? Not necessarily, but it could look like that from the outside. Again, delayed gastric emptying, if the nerves are not functioning properly and it's not moving the material through, that's going to be a problem. So the major diet change that we talk about is alfalfa hay, 24 hours, 7 days a week, and you put them in a nibble net or one of the slow feeding hay nets so that they can eat it consistently over a long period of time without gorging themselves on it. Takes their time to get it into them. Multiple smaller grain meals with a low starch diet is potentially helpful. There's been discussion of corn oil. I think there was discussion a long time ago about corn oil being beneficial for hindgut ulcers, which we're not talking about today, but there's a possibility that maybe corn oil has some benefit. But certainly consistent feed and a healthy environment is beneficial for these guys. So here's a couple of different examples of nibble nets. And basically they just have very small openings so that the horse has to work to get his lips on the hay to pull it through the small holes. It takes him much longer to eat, which is what we want. So you can hang one of those bags and hopefully it lasts for most of the day, and then you hang another one and hopefully it lasts for most of the night.
Well, hopefully they don't rip it down.
And hopefully they don't rip it down and they don't tear it to shreds.
That's been no doubt.
Yeah, and the
will
other thing that's an issue with that is that some of the barns, it takes manpower. It takes human time to stuff the bags. There's some people who have gotten very good at it. They can do it very quickly, but you don't want to hang it in the back corner of the stall because then you got to go in and get it. You got to bring it out. You got to stuff it. You got to hang it. So there's some people who have gotten very good at it. I think it's worthwhile to figure out how to make it happen in your barn because it's definitely a potential benefit. One of the things that has recently been talked about is there's a recent study where they looked at the effect of omeprazole on stomach acid with hay and with fasting. And that may change the way that we do things with this because horses that are fasted, when you give them the GastroGuard, their stomach acid production goes down dramatically and the pH gets better. When you give horses that are getting hay GastroGuard, it doesn't affect them very much. So one of the things we want them to do is to always have hay in front of them, except maybe when we're treating them with GastroGuard. So I don't know that this is right or wrong, but what I've been trying to do with them is at least stop the hay for a few hours, give them the omeprazole on an empty stomach, the GastroGuard on an empty stomach, and then wait probably 60 to 90 minutes before they get food again. And hopefully I can get the best of both worlds. They're hopefully eating all night and then you stop it. But again, it takes more human time and ability to get that stuff organized to get it done. But the new thing that they're working on, which is going to be a while, is injectable omeprazole. And if they come up with an injectable form of omeprazole, we won't have to worry about putting it in the stomach.
That's
So
a good idea.
someday that might help. So to wrap it up, gastric ulcer syndrome in horses is very, very common. We see it a lot. The clinical signs are non-specific. So any number of things can tell you that these horses have stomach ulcers, and they could also tell you that he's colicky, or he's got parasites, or he's just got a bad attitude, which is why gastroscopy is important to diagnose them. We can definitively diagnose them because you can see them, and sometimes it will change how we treat them depending on where the stomach ulcers are. Omeprazole, which is GastroGuard or UlcerGuard, is the treatment for them for the most part. Possibly antibiotics, sucralfate, and other supplements. And certainly feed changes, multiple feedings of grain during the day, and alfalfa hay, preferably alfalfa hay, 24/7, again because of the calcium in it that helps buffer the stomach acid. So,
I have a question for
yes.
me personally.
So do I.
So, say your horse is confirmed with ulcers, does deworming them affect that at all?
It shouldn't.
I just wasn't sure if if their stomach is already sensitive, if putting a dewormer in
I
them
see
would,
what you're saying. Could it make them more sensitive to the dewormer?
Right.
That's a good question. I haven't seen that. I suppose anything is possible if if their stomach is already upset and they're feeling discomfort in there. It's always possible that some of those things could happen. And again, some of the times they go off their feed if their stomach's hurt. So again, a non-specific thing that could be from any number of things, but specifically on wormer, I have not seen that, but I wouldn't be surprised.
Okay.
The new grain's coming out. I know Race Ready's going to be coming out pretty soon with their version of their ulcer treatment, and tributes Ultra Gut Health, I think is the name of it. And then the other ones that say that they're supposed to help with ulcers. What's your take on that? Do you think it's something they're just adding because it's the way of the world and people are just thinking ulcer, ulcer, ulcer?
Probably. I don't know what they're adding. Is it just buffered?
I'm not 100% certain. Yeah.
I would bet that it's buffered. I saw a product today that it was gastric something, hind gut something, and it was like, well, those two things aren't the same, and whatever's given into the stomach may not ever reach the large colon. So yeah, you have to read those labels and find out what's in them. If they're trying to do the calcium and magnesium and aluminum supplements that help decrease the acid by buffering them, it's probably worth a shot. But again, those are limited in time and scope. They only last for a couple hours. As soon as the stomach is emptied, there's no more effect on the stomach acid.
Yeah, like some of these other ones, with Succeed, it's hard. You should really, if you really think you have an ulcer, you probably should definitely get scoped. If you really can't afford scoping, then maybe just talk to the vet about doing like a 28-day trial with your GastroGuard, UlcerGuard, and talk it out that way. Because even if you go with some of these, sometimes you defeat the purpose because they're not eating.
Yeah.
So then that's where you have to talk with you in regards to which way to start doing something.
I don't think this is the best way to go about it, but one of the things that I'll do with them, if they have an attitude problem, and it needs to be an attitude problem or something that's consistent,
right,
is to give them a half of a tube of GastroGuard for 6 days.
Okay.
So we sell them 3 tubes of GastroGuard, give it to them a half a tube a day for 6 days. It's not enough to be a treatment, but in a lot of horses it's enough to make them say, hey, I feel better.
Right.
But you need to be actively involved with those horses during that time period to see if their behavior changes. And I've seen that happen multiple times. But again, it's not as good as the gastroscopy is to actually identify where it's at and whether you might need something else. So we have a package deal, and we sell GastroGuard as well. But we have a package deal that gives you a pre and post gastroscopy and the GastroGuard.
right.
But basically a regular gastroscopy, one gastroscopy, if you count the tranquilizer, is less than $300. So to get in there and look, before you spend the money on the GastroGuard that can run $30 to $40 a tube for 28 days, usually it's going to be at least a tube a day, depending on the size of your horse. It's a lot of money. So I don't like to treat it lightly, but the drug, it works really well. The other thing that we've had in a lot of cases, not a lot of cases, but certainly often enough, is we'll go in and we'll see these kind of ulcers in the main part of the stomach, and we'll treat them for 28 days with GastroGuard and then go back in and scope them.
Mhm.
And now all of a sudden you'll have a pyloric lesion that you did not have before.
Because you're able to uncover.
Well, no, I don't know why. That's part of the frustrating thing is you've treated them with the GastroGuard,
Right.
and you've gotten rid of the ulcer in the main part of the stomach, and you've already looked at the pylorus before and there was nothing there, but now there's a lesion there. And then what you have to do with those, I think, is add the sucralfate and the antibiotics and do some more GastroGuard and then come back and look again. Now again, this pony that had lesions everywhere, it was one of the worst ones that I've seen. She was probably a 900-pound pony, and we gave her a full tube, which I think goes up to $12.50 or something like that. We gave her a full tube of the GastroGuard for 28 days, treated her with sucralfate and minocycline, and she was spectacularly clean when we were done.
Right.
So
It's well worth it if you can. I mean, if
Absolutely.
you want to do what you think is right, like feeding every day or whatever, but at the end of the day, you're not getting any better and you're not performing better or whatever, kicking at your stomach and stuff like that, or even maybe colic or just heartburn, you know?
yeah,
Probably
and
better off just taking the time to do that.
again, I think the attitude change is fascinating to me, because you'll see that pony in particular was supposed to be a sweetheart. It was very nice. It was the grandkids on the pony. It was really, it was a wonderful pony. And then over the course of a few months, it just got nastier and nastier.
Right.
Wanted to bite them when they were around it, swishing its tail, ears back, just really bad attitude. And, once you start on the GastroGuard, those things change. They get better.
Any
Well, we have a
questions?
question. Well, we have several, but we'll start here. Extruded feeds, do they really help?
I don't know. That's a great question. I have not heard anything about extruded feeds. I would have to talk to the people making the feed and find out why they thought that was a benefit. I think the low starch feeds are beneficial. More protein and more fat, I think, leads to less stomach acid production.
Okay.
But extruded specifically, I don't know.
All right. Next question is it okay to ride your horse after they eat their grain?
Yes, other than you need to realize that the acid production is increases with exercise, and you're going to slosh it around more. So in a normal horse, in a normal situation, it's probably no big deal. I wouldn't stop people from riding their horse after the grain, but if they have a stomach ulcer problem, it might be something to consider. Let that grain get through their stomach and get a little hay into them before you ride them.
Okay. Shelby has performance horses that she travels 2 to 3 times a week in the summer with, and she feeds free hay. What are the best prevention methods? Are there any supplements that help prevent?
Well, that's a great question too, because there's no way to really know until we start doing testing. I think the big thing is to know if you have a problem, you need to be on top of it to keep it from happening again. But to prevent something from happening, no, don't use non-steroidal anti-inflammatories unless it's Equiox. Equiox is a COX-2 inhibitor as opposed to an antiprostaglandin drug. So it works differently than butanbanamine and the like. So Equiox doesn't cause stomach ulcers like butanbanamine do. So if you can avoid butanbanamine, if you have a horse that's sensitive, then I would not use those products. And again, have hay in front of that horse while it's trailering all the time, and try to decrease the stress level as much as you possibly can with the way that you drive, the situation where they're at a show or whatever, if they're near a horse they know. All of those things help decrease the stress levels, and when the stress goes up, just like in humans, the stomach ulcers and reflux gets worse.
Okay. Our next question is from Amber. Do you recommend giving buffers along with butanbanamine?
Maybe, but that's not necessarily the problem. The problem is that the antiprostaglandin drugs, butanbanamine, the prostaglandin is one of the things that helps protect the stomach lining. So if you could decrease the acid production or decrease the acid amount by using a buffer, that may help, but it doesn't change what you've done to the stomach lining. So it's not the acid so much as the lack of protection from the acid that the butanbanamine causes. So there's nothing wrong with giving a buffer with butanbanamine. It's just it's not the end all be all with that.
Okay. I think our last question is, Ashley, for those people who use Succeed or Ulcer Guard, I've noticed that they use them irregularly. Does this affect the ulcer? It doesn't really treat it if it's irregular, correct?
Yeah, the irregular treatment, probably not so good. For Succeed, I can't really speak to very well. The Ulcer Guard, again, it binds, so it lasts you for that daytime, as opposed to having to give something that you give repetitively. But if you're not giving it on a daily basis, then anything that you've gained, you might very well lose the next time. So if you're treating them, you need to be on a consistent basis so that you're trying to let this thing heal without it getting worse and better and seesawing back and forth. If you're using them to prevent, it's probably fine if you know that you've already cleared your ulcers and you're just using it for that short period of time.
Like if you're traveling somewhere or something like that, you can use it.
The other thing that I didn't talk about that is worth mentioning here is that what they found is you don't want to just take them off of the Ulcer Guard at the end of a 28-day treatment, because people get this too, you get a rebound acid production. So what we've done now is usually we'll give them a half a tube for 4 days and then a quarter of a tube for 8 days to take them off of it. I've had at least one horse that got uncomfortable right away when it came off of the GastroGuard, and I think that's what happened, is that the acid production jacked back up again.
The pumps were like, woohoo!
Yeah, exactly.
We're free!
They were free. Spitting the acid out. So,
yes.
So decrease, once they're on that long-term treatment, you need to decrease them slowly to get them off of it.
Okay, what if you do not have access to quality alfalfa? Can I use alfalfa cubes? That's from Faye. She wants to know.
Alfalfa cubes should be great. The concern about alfalfa cubes and alfalfa pellets and Timothy pellets is they plump when you add water. So in my mind, I would never feed them unless they're wet and plumped, because horses choke on them. I just had one choked on Timothy pellets 2 weekends ago. So, and alfalfa cubes will turn into mini hay bales once they expand, and if they're not wet and the horse eats them and they start to swallow them and it hits the saliva and those things expand, they choke, and it's miserable to get those out of there. But the alfalfa cubes and alfalfa pellets should definitely help. They still have the calcium in them that will help as a buffer.
Okay. So Tish, do you want to tell about our awesome deals?
All right, well, what we have today is we're going to like, share, and comment. And then on, what do we decide? Friday, we're going to do some drawings. So what we have to give away is we have a bucket of Maalox, and we have 6 boxes of a 30-day supply of Succeed, and then we also have 4 of the U-Guard pellets. At least, you know, going with his theory and stuff, maybe you just want a preventative, or maybe you're not have access to the scoping. It's something that you can at least try. So these products here, and then Ulcer Guard. We don't have any promotions on it, but if you're a regular user of Ulcer Guard or even the Gastro Guard, they have a Marriott Max program, which is great. All you have to do is make copies of your invoices, sign up on their website, and you get a credit card that's reloadable, and then you can use that for anything that you want, whether you want gas or food, or even buying some more Big D products, or going to the vet, however you want to do it. But any of our customer service gals can help you, walk you through it. I can do it, and it works out really easy. So like, share, and comment. And if any other questions, are we good?
We also have 10% off.
Oh yes, I'm so sorry about that. Yeah, for the next 2 days we have 10% off all digestive products. So, which does not include Ulcer Guard, but everything else from Omega Alpha to Kentucky Performance Products, Succeed, U-Guard, who else is out there? Cox Vet Lab, the GastroAid. Anything that calls our category as digestive, give us a call for the next 2 days. We get 10% off.
Was there a code that they had to use? Is that
DG17?
the 17?
Yeah.
So if you add it to your cart and you put in the promo code DG17, you'll see the 10% come off of the digestive products, excluding Ulcer Guard. So.
Yep. All right.
And one more thing, just to advertise a little bit, is that we, unfortunately, veterinarians usually have to charge more for the GastroGuard than other places can sell it for. But what we can do is we can put a package deal together where we can give the gastroscope at the beginning and the end. It works out very nicely overall, and we also get a discount. They can also get the rebates back from Marielle as well through the veterinarians. And if you buy it through the veterinarian, you can get more money back, but it's going to cost you more from the veterinarian usually as well. So.
Yes, but also at the end of the day, you also know what you're dealing with too.
Right. Yeah.
And that's most important as well. So.
Well, I think we are
Think we
done
got
with
it
questions, and just thank everybody for joining us, and thank you, Dr. Keckler,
You're
yet
welcome.
again, and thank you, Tish.
All right, thank you, everybody.
All right,
Like,
bye,
share,
everyone.
comment.